Hello everybody, this is Carol Ann. Welcome. I have posted a few videos on YouTube prior to today, but today I'm going to do one that's a little bit different. I want to tell my story of neurological odd disorders that have occurred with me over the years, but one in particular they diagnosed as Parsonage Turner Syndrome with diaphragmatic dysfunction. That's a mouthful. And basically what it means is that the two phrenic nerves in my body, and phrenic nerves feed off of your upper spine, more or less across your shoulders, and they control some of your arm movements and muscles, as well as your diaphragm. Your diaphragm is the large muscle. There are two sides, right and left, that lay below your lungs and above your abdominal organs, more or less in between, like a flat, like that, horizontally and flat. They control your lungs and allow you to inhale and exhale. Inhaling is pretty important, but exhaling is also quite important. We don't realize that all of the time, just what exhaling does for us, but I am a retired registered nurse. I retired in May of 2021 unexpectedly because I developed Parsonage Turner Syndrome that affected my phrenic nerve and my diaphragm muscle. So I woke up one morning. I had been having pain in my right, I believe it was my right side first, right upper back shoulder area from my neck across to my shoulder. And I thought I had pulled a muscle. I mean, it hurt. It was definitely painful, but I had no idea what was really happening. That started, and about 2 days later, when I woke up in the morning, I couldn't breathe very well. I couldn't take a deep breath. And I certainly didn't understand that. I had no lung problems, or never a smoker ever in my life. And just, was relatively healthy, overweight, but healthy. I was in a class that day because I had just accepted a new job with, believe it or not, a maximum security prison system nearby where I live, in their medical department as their assistant director of nursing. And I was so excited. I had worked different jobs most of my life, and most of them in the hospital setting. About a year prior to this opportunity, I had accepted a position with a local jail. It was full-time, and they had a medical department, and I just functioned as their supervisor and night nurse, essentially, to pass meds and help keep things organized and, just keep the place going. But we took care of the inmates who had health problems. Sometimes they stayed in our department if they were having an acute problem. Sometimes they didn't. They were in their own cell, and we would take their meds to them and so on. Go to them and check them out if they developed something new or whatever. I got a taste of dealing with that side of the bars, and I liked it. It gave me opportunity to share goodness with people who didn't see much and maybe never had, and I tried to. But anyway, so I accepted this position as assistant director of nursing for the maximum security prison, and the beginning of that job was 2 weeks of class time to be oriented to the job and learn some things about the laws and how you handle certain situations behind bars as opposed to out on the street or in a hospital setting. It's pretty different in some ways. And it was awesome. I was learning new things, and it was great. But toward the second half of that second week of class time is when I started having this pain. Well, Friday morning, when I woke up and couldn't take a deep breath, I thought, well, I'm just going to go ahead and go to this last day of class. I felt like it was important, and I did. And I sat there in pain and breathing all right as long as I was sitting still and upright. Laying flat started to bother me, but Not too much, but anyway, walking definitely. I felt it when I tried to walk or do anything. I was getting pretty winded. So that afternoon, when I walked to my car, it was our first really hot day in May. It was close to 90 degrees. I opened my car door. I had a black car at the time, and it was just radiating heat. And I thought, I sat down, and you may not know this, but if a person has a breathing problem, heat like that or extreme cold, either one can make it worse real quick. So I could not sit in that car, so I had to turn it on, wait till it cooled off, and then sit down, and the cool air conditioning air helped quite a bit, and I caught my breath, and I did fine, and I went home, and I thought I should go to the ER. Bad nurse. I didn't. I should have. That could have been anything, including a blood clot in my lung, and I knew that. I just kind of didn't want to deal with that. But the next morning when I woke up, it was no better and a little worse. So that time I did go to the emergency room. They did all the testing they do. This is a rare disorder. It doesn't happen very often. Some doctors and nurses never see it. I had been a nurse for almost 40 years at that time. I had never heard of it. Never had a patient with it. Nothing. So, yeah, that's how rare it is. So, they were puzzled. They understood that there was something going on, probably with my diaphragm. They did not know what it would be. So they sent me on my way with orders for outpatient testing and to see a specialist and so on. Okay, so I left and went about the business of seeing some specialists. Most of them hadn't even seen it or didn't know what it was. The doctors who gave me a clue at the onset of this weren't the pulmonology specialists, and they weren't the neurologists. They were just doctors who maybe had seen something similar and said, you know, you might have. Yeah, but nobody was giving me good answers. But anyway, almost 1 month later to the day, almost, June the 22nd, I started having the same type pain on the opposite side of my body. So first it was on the right, this time it was on the left. The pain up across here, kind of down into my back, my shoulder area. It might have hurt a little more when I took a deep breath. I can't really remember. And then I really was concerned and puzzled because apparently when people develop any kind of neurological thing this way, it usually only affects one side. So like I said, nobody really had a clue yet anyway. So 2 days after the pain started, just like the first event, I didn't wake up in the morning. I started waking up through the night, realizing my breathing was definitely getting worse, much worse. So very early in the morning, I had my husband take me to the emergency room this time. The first time I took myself. That's what you do when you're 60-some years old and pretty independent. But yeah, I had him take me, and I knew this was serious because I really was struggling to breathe, especially if I tried to lean back or lay down. Oh no, I couldn't. And in the healthcare world, they call that orthopnea. And it goes along a lot of times with people who have COPD, if you've ever heard of that, or emphysema. Those are lung disorders, not neuromuscular, but in the lungs themselves, problems. But it does cause people to not be able to breathe well when they lie flat. So a lot of times you'll see people with that disease sleep with a bed that they can have the head of the bed or on some pillows or in a recliner, whatever works for them the best, but they do sleep upright. But my breathing was very, very difficult, especially with any activity. Walking from my bedroom to the bathroom, which is right off of the bedroom. It's an ensuite, as they call it. Nothing fancy, just a bathroom. But just walking there, I was so winded, I looked like someone who had run a mile. That is not an exaggeration, and it was so scary. So back to the same ER at first. They kept me for hours. They did more testing. They were starting to get a little bit of a clue, that it was not lung, it wasn't blood clots. They had done all the tests to look for things that were common. I wasn't having a heart attack. So they put me in an ambulance at 2 o'clock in the morning and that's the next morning, sent me to, I lay there all day, I sat there. I could not lay down at that point. I sat on the edge of the cart most of that time, because even having the head of the cart elevated as high as it would go wasn't high enough. I had to sit straight up, like a 90-degree angle, and that's the only way I could breathe comfortably. So I did that all day long. Yes, life in the ER.